Just having a conversation right now, Dr. Keel, about bladder cancer and just how common it is. You know, welcome back to Fox News at 4. This is a very important topic, and we were discussing just how common it is, even though mostly older adults get it.
Mostly older adults, but it can happen in anybody. I mean, my age, which I consider myself young, some people say old, but but yeah, fourth most common cancer. Yes,
and so talk about the technology that's being used now.
The technology we use today, at our office, we use something called blue light cystoscopy. It's a way of performing flexible cystoscopy, and so bladder cancer is the most important thing about bladder cancer is catching it early. Because the earlier you can catch it, the more easily it is to treat. We use flexible cystoscope, which is just a small camera that we put into the bladder, and we can do that in our office utilizing a drug called Cysview.
How does that compare, though, to the standard procedure?
So the standard white light cystoscopy that most people are familiar with is a way of looking in the bladder, same technology, but this new scope actually uses a molecule that we insert into the bladder that attaches to the cancer cells. And if you, I tell everybody, think about a black light. If you were a kid and you had a black light and a glow-in-the-dark sticker, that's literally what the cancer looks like when we see it under this special light.
Oh, wow. And you alluded to this just a moment ago, but this has been an investment, this procedure that you guys have now.
It has. It's a significant investment for USA Health and into the bladder cancer community. We're the only place that offers this in our office, and so it's a nice tool to have, particularly for early detection. And
talk about the significance of being able to have it done in the office, say, as opposed to in a hospital.
Sure. So we can offer it. It's a walk-in procedure. It's something that you can just come in. There's no anesthesia required. It's not painful, versus if you had to be put to sleep and you spend your whole day in the hospital and waiting and all those things. We like to think that you don't have to wait that long at our office, but it's something that allows you to just walk in and get it done and go back to work after lunch or however you want to do it. So.
And we talk about cancer and how early detection is key, but again, express the significance of that and maybe the warning signs.
Sure. So bladder cancer being the fourth most common cancer, warning signs are typically blood in the urine. That can be caught. That's the reason it's important to see your primary care physician, because that's one of the things they check for. And so early detection, when we detect bladder cancers that are small, they can be easily treated, sometimes even in the office, up to the more advanced procedures that we have to treat them, including sometimes bladder removal, which is if it's that late, we want to catch it before it gets there. So.
And there's steadily advances being made towards fighting this cancer, such as the technology you were just talking about.
Absolutely. New, and then now we're doing robotic surgery on bladder cancer. There's a lot of advancements, not just this. There's new drugs coming out. There's new chemotherapeutic agents, and so the bladder cancer market and the bladder cancer community is expanding as our population ages. So it's the right thing to do to try to take care of these patients and invest in that community.
Wow. Well, we appreciate you stopping by.
Yeah, thank you for having me
and talking to us a little bit about this.